the head of state has been the chairman of the AIDS Council until last year, April. But he has continued. I mean, the former president has continued as the chairman because really he did well and he was vice chairman. So the present president felt that he should continue. And at the AIDS Council, the vice president is the vice chairman.
In Botswana, the Ministry of Health has put in place its own care worker support programs aimed at providing training, equipment and financial support for care worker organisations. A key aspect of the Botswana government's policy on AIDS is its family care programme. Families caring for orphan children receive financial support, food packs, school fees and uniforms, plus free healthcare from the government of Botswana. Away from the beaches and hotels, the people of Mauritius are busy coping with their own version of the HIV and AIDS pandemic. Here the problem is still poverty and a damaged social order where drugs fill desperate needs for some poor people, particularly the youth.
I think it's very important to understand that in this country, HIV and AIDS is the concern of everybody and is taken care of from the highest level. The National AIDS Secretariat is chaired by the Prime Minister, who ensures that the policy measures that are taken are implemented.
In Mauritius, the Ministry of Health has put in place needle exchange programs for drug users, programs that target sex workers, and prevention of mother-to-child transmission policies in hospitals that offer support for HIV-positive mothers and their children.
We also provide antiretroviral drugs free. Healthcare is totally free in Mauritius. And we also have a very good partnership with the private sector and the NGOs to make sure that we get the desired results in the fight against AIDS and HIV.
Today, in spite of mighty efforts on the part of many individuals and some governments, Southern Africa is still struggling to cope with a serious HIV and AIDS pandemic. Initially, far more men than women were infected, but now Southern African women of reproductive age are 4 times more likely to be HIV infected than men.
The issue of HIV/AIDS care is actually more burdensome to women than to men. And maybe it's about time that as society or the whole world, we need to look at and ask ourselves questions, what can we do as a society to encourage men to come and join, in assisting and caring for women?
Some men in the region are showing a willingness to take responsibility for their actions and to share the burden of care with our population of overburdened women.
It's very interesting that the theme of this CSW is not just about HIV and AIDS and care work. It's cast in the broader framework of sharing responsibilities between women and men. And I think that's very important to keep sight of that, is that there's a much bigger issue here, which is the unequal division of labor within the home.
So for instance, we had the program on safer motherhood. And the safer motherhood program we critiqued in very great detail. And we said safer motherhood is again putting the responsibility on women. Where are the men in this context? And we reconceptualized it also to talk about safe parenting, safe parenthood, where men were part and parcel of the equation.
The African Fatherhood Project is a fantastic project in our part of the region that has begun to put a spotlight on fatherhood, on missing fathers, on the role that men could play. Imagine if men were sharing these responsibilities that women have around HIV and AIDS.
Recent evidence has shown that ARVs are buying a window of opportunity by lessening the burden of care. But best estimates are that they give people on average about 100 months of quality life before resistance starts to build up again and we see people becoming extremely ill in large numbers.
Because of ARVs, we've really now relieved people living with AIDS are no longer sick. They are fine, they're working the streets, most of them. Now, while that burden of care is still down, we need research to say, how do we do it better next time?
To take the issue of care work forward in the next 3 years, what GEMSA is planning to do is first we're going to start on a baseline study the reason why we need to do another baseline study is that, care work is an area which is constantly changing, and we need to update ourselves in terms of the policies that exist in the region right now. So we're going to do that in approximately 13 Southern African countries.
Because there will be a next time. In my prediction, you can be on ARVs for just so long. We don't know how long. After 20 years, are we now going to find people having resistance and therefore now needing home-based care? So if we had models in practice, in place, wouldn't we then be able to utilize those models then, rather than saying, oh, another crisis, let's do this?
So the question is, can we use this window of opportunity to look at the achievements of these ordinary men and women who, largely without official support, are finding ways to cope with this burden of care brought on by the epidemic of HIV and AIDS? If we do not step in with support, then we will lose them, and all the knowledge and skills we will need to overcome the next looming crisis.